I was going to put on your pants.
All right, well, we might as well get started. We've got about 22 to 25 people in here, something like that. Bob Haley said he was coming. I waited a little bit longer. He's not going to make it. Oh, okay. I was waiting a little longer to see if he would show. But my name is Jim Yount. I am the husband of Dr. Crossley. But this has nothing to do with that. I am here out of a concern that there be more community involvement in the process of figuring out the future of Rainy Lake Medical Center, and I've been waiting for the board to engage with the public for 3 or 4 years, and there's been very little of that, and I decided with the deadlines pending for decision making that I wanted to start holding meetings regardless and try to put together as much information as is possible that's in the public domain to share with the public. We had a meeting 2 weeks ago exactly with about 50 people. A lot of questions were raised. That was the whole point of that meeting. I haven't written them all up yet, but the video is up on YouTube, and I will put all the meetings up on YouTube or otherwise on the website as they become available, and any other information I can gather from various sources that will help shed light. This meeting is not sponsored by Rainy Lake Medical Center or by Essentia or by anyone. It's just my own personal initiative. I thank the college for letting us use the theater, and Jim Bujold for tweaking the microphones, which are definitely better this week than 2 weeks ago. Some basic ground rules. Everyone should have a chance to speak when it's time for questions and comments and such, without monopolizing the time. Obviously, we want to be respectful. And we want to focus mainly on constructive questions and information and avoid as much as possible the rumor mill, although one of my concerns is with as little communication as there has been, there isn't a whole lot more than rumors to go on. But hopefully that difference between rumor and fact can be better balanced. And I'd like to avoid as much as possible strictly confidential information. It can be a little unclear sometimes what is supposed to be confidential and what is not, but I err on the side of trying to keep the information that is supposed to be public. My vision for these meetings, the public deserves a say, and the board has not been providing that so much, has not been open as I would like to see with the public, although they have to keep a number of the discussions, general meetings, and particularly negotiations with Essentia or any other partner confidential, and I do expect that. But it strikes me that major decisions affecting the future of healthcare in any community are far-reaching for the entire community, and there has to be some degree of public buy-in for them to succeed, and ideally the public can also help to reach a better path. I will continue to have meetings as long as I have guests or information to present myself. I am contacting other organizations that have been through the process of integration with Essentia, or other organizations, or that have decided to continue to go it alone, because hearing from those different communities can help shed light on the actual realistic possibilities of what could happen. Particularly in the case of Essentia, there's a whole bunch of speculation and fear as to what might happen if Essentia took over. By speaking with the 4 or more communities that have recently been through integration, we can narrow down the room for reasonable speculation, have a more realistic idea of what to expect, as well as learn from them and the negotiation strategies that they used in dealing with Essentia, and their suggestions for how we might want to proceed as a community. In the 2 weeks since the last meeting, I have not gotten nearly as much information as I have or would like to gather up on the blog that I started, which is RLMCPublic.blogspot.com, and I can email that to anyone who wants it. But I am indeed getting some very useful information. I've been building lines of communication with Essentia, Rainy Lake Medical Center, the Data Journal, Minnesota Public Radio, the National Rural Health Resource Center, which was started in Duluth in 1990. It's nationwide, but it still has a little extra knowledge on Minnesota. And I just had a very good conversation, or 2 conversations with Mary Klink today, which I'll be talking about later. Also had a conversation on the record with Mayor Bob Anderson, but not as mayor, for about 20 minutes or so in his office, and that was very interesting and I thought constructive. And I definitely need to put more information in the work. So, any questions on the big picture about these meetings before I go into a little bit more information about Deer River and Mary Clinton and Bob Anderson?
If you got the data journal, do we have a representative from the journal there?
No, they chose not to send anybody to the last meeting or to this meeting. I'm not sure why exactly, but they do know that these meetings are being recorded and available on YouTube, and I've met with them 2 or 3 times since I started, well, in the last 2 weeks, to discuss their coverage, and I've been happy with the changes I've seen in their coverage, a little bit more of it. They've had 2 good articles, mainly based on interviews with Charlie Holloway, who's the chair of the Rainy Medical Center board. So, it'd be nice if they were here at these meetings as well, but they're definitely in the loop. Yes?
Yeah, lost a little bit. What was the intent? I mean, is the intent to gather the questions and to find out more information so that you can present it to the board or to the community? What is it?
Broadly speaking, what I want to see is that the board and the community figure out the best possible solution for long-term health care for the community. And everything else needs to be weighed against that. What I'm trying to do personally is, there's so much rumor and fear and speculation kind of out there like wildfire, and that just flourishes in the wildfire, flourishing in a vacuum, but nonetheless, you get the idea. The more actual information and communication can help quell the rumors and calm down some of the fear and concerns out there, and hopefully allow us to focus more on what the actual situation is.
So you're going to present it to the journal? I mean, how are you going to let the community know
Right.
what you have?
Well, I started a blog, and anyone can access that anytime I'm behind updating it, but that's where I intend to put all the information I can that is public. The journal has access to that. Some of the discussions, I think, have perhaps influenced their coverage. I discussed a few conflicts of interest they might not be aware of, and
well, my concern is the fact that we have an elder population in National Falls, and they're not out there looking at your blog.
No, I know. Holding these meetings, word of mouth. Any other suggestions for how to get the information out there? I asked last week or 2 weeks ago about Facebook, and there was kind of not a huge outcry for that, and certainly that would help the elderly community.
I wonder if they had data posts like at Woodland Apartments and Ron Ross and maybe West Falls, where our elderly population is residing.
Yeah, and I would happily
just put up posters.
I would definitely have more help putting up posters, and just anyone who wants to. What I'm doing, anybody can do what I'm doing. I hope to serve a role as a reasonable conduit of information. Out of as much as I want the board to communicate, we also need to respect that they've got their legitimate reasons for minimizing communication to some degree. I didn't phrase that very well, but it can be challenging for the board to figure out what they can and cannot say publicly, and to get information also from Essentia takes a little bit of work, but I've found, I think, the right communication channels to get questions answered as they come in. So although anyone can do that, what I'm mainly trying to do is gather the questions and then present them to people that I think can shed light and information on the questions that the community is raising. And I've been getting one friend of mine has been taking questions from people that are not comfortable even telling me off the record what they want to know. And she's been sending their questions anonymously to me so that I can move them on to whoever may shed light on them. And yeah, I'm open to whatever other ideas people have as to how to get useful information out there. Any other points on kind of the big picture? All right. Well, on Deer River, just the basic big picture in Deer River. Deer River had a clinic that has long been part of Duluth Clinic and an independent hospital, much like we had here. They did not do a trial period like we have now with Rainy Lake Medical Center, but the hospital looked at their options and decided that they needed to merge with a larger partner. and they had a long-standing relationship with Essentia, and all their doctors were from Essentia, and that seemed like a natural choice. They did not formally evaluate any other partners, but they have people on the board have friends and contacts in other communities, and one of the concerns they said they had was they had heard that Sanford allowed even less local control than they had heard Essentia might allow. So they just went with a formal agreement to pursue an affiliation, an integration with Essentia, which means Essentia would then have full ownership. And they did have at least 3 public meetings prior to finalizing that integration. I'm not sure exactly at what stage. It might have been in a later stage than we are currently at locally. But she said that those meetings, the people I've talked with there said that those meetings were very constructive in building a good communication with the community at that time. In negotiating with Essentia, Essentia agreed to have no net job loss, which is very relevant to a lot of the concerns here. That if any positions locally in the Deer River area were eliminated, that those people would be retrained and hired in another position. And they had one person actually get a promotion and be moved to Duluth for a higher paying job, which was considered within the system. And essentially retained the entire hospital board and added Mike Motley, who he works with all the boards of their regional healthcare facilities in the Essentia East category. So that was some interesting big picture details from that. Now that integration has taken place there, which was finalized in September last year, she said there's actually an increase in the number of specialists that they have. The main problem has been that Essentia is overextended. They have been expanding so fast in the rural facilities that they have integrated with that they're a little overstretched as far as deploying the resources and stuff that they have agreed to. The impression was not that they are reneging on that, but simply that it's taking a little longer than expected. I was also told that, to their surprise, as far as working out the various details like changing from basic life support to advanced life support with their ambulance system and many other details like that, they were surprised at the degree to which that initiative needed to come from them. Initially, we were kind of waiting for the marching orders from headquarters and weren't particularly getting some, and they began asking for the things they thought they needed, and we're happy that the Essentia staff in Duluth was relatively responsive. So at least from that perspective, and this is from a board member that I spoke with there, it was a relatively constructive process thus far. But it is still very early in the process. There's certainly some tensions and growing pains, details to be worked out. It was also suggested that we go ahead and speak also with people that have integrated with Sanford and get their perspective. That's a possibility. I don't have my notes with speaking with Bob Anderson, but I spoke with him on April 2nd. Here we are. And the main concern I wanted to talk about was the desire for public meetings, which I think is widespread in the community, with the board. He said he was open to that, and possibly even as early as next month, as far as he was concerned, there could be potentially meetings with at least members of the board and the public, if not the entire board. And he said, I had forgotten this if I was ever aware of it, but there actually had been 2 public meetings of the Bailey Medical Center board during the first 2 years. They were basically, my understanding is, just presentations of the annual financial data and not a lot more than that. The attendance was very sparse, and they decided to stop having those meetings afterwards. So at least there's that precedent, which is interesting. I asked about the existence of studies done, Falls Memorial Hospital, the clinic, and Essentia, in the past, whether they were in fact studies out there that could be potentially presented to the public. He said there were at least 2. The main one he talked about was done by Essentia and the hospital prior to forming Bailey Medical Center. And the outside people that they hired to do that study, he said, concluded that it would be advantageous to form a collaboration such as a Baylor Medical Center was intended to be, and that would be more economically profitable. But he said he would not favor releasing that study to the public because he felt it was very flawed in as much as that prediction of financial benefits, he said, has not panned out, and that the combined entity has been running at a net loss. My reply to him was that whether it's flawed or not, there must be a lot of basic useful information in it, and the solution I feel would be to release that and other studies along with commentary on them, the critique and evaluation. So basically my approach is that the answer is more information, not less. However, he did say that at least the studies, the summaries of the annual financial reports at Baylor Medical Center, he was entirely sure, but he thought they were essentially public documents, and that he was in favor of aggregating those all together and releasing them at a public meeting of the board. We'll see. He's not speaking for the board; he's speaking for himself, but as a board member, and we'll see what follow-up there might be on that.
Jim,
Go ahead.
the IRS reports are available on GuideStar.com
Okay.
for all nonprofits.
Okay.
So that's where I got the hospital tax return.
All right, and that's part of what I'm trying to find out is what information is already out there and pull it together. So, yeah, we ask you for the link to that or just Google it. I also asked Mr. Anderson about the potential conflict between his roles as mayor and his role as the board member of Green Lake Medical Center. He said that whenever either organization was discussing the other, that he would simply abstain himself from that discussion in any votes, and that seems entirely normal and satisfactory. As far as the possibility of the hospital ever being independent, which at least has been considered in the past prior to the Green Lake Medical Center being formed, I asked about the possibility of there being a taxing district to support the hospital, as it's done in some communities, and he said that's a possibility. That would be a decision for the county board to make. The city can't form taxing districts, but the county can, and it's a county scale type of enterprise anyway. So those were the main points from that discussion. And then finally, I spoke with Mary Clem just today, so it's pretty fresh discussion. You may know she was the CEO of Falls Memorial Hospital for about 6 years, and then 10 years ago she moved to New Prague, to become the CEO of the Queen of Peace health system, which is multi-location, multi-clinic, multi-hospital. And she said in, I think it was 2009, they held an annual meeting of the board with her and felt that, everything was going along, just fine. They should continue as is, independent and such. But about 6 months later or so, they started looking at the changes coming through Obamacare rolling out, and other changes, and decided that, it really was going to make a lot more sense for them to seek a new partner. And they were able to do so from a position of strength. She said they evaluated about 6 different potential partners, mainly in terms of their cultural match, institutional cultural match, and several were quickly eliminated. One, I think she said Fairview didn't have any rural critical access hospitals, so they were concerned about being the first and only within the Fairview system. And Mayo Clinic, she said she thought was a really good match. In particular, she mentioned that it is a physician-led organization, as is Essentia. I don't know if they have the identical structure, but you may know in Essentia, all the administrative positions, there's a physician paired with a more traditional administrator filling essentially the same role, but two people doing that. So Mayo Clinic has a similar structure, and particularly the physicians within her health system thought that was a good match. Their board at the Queen of Peace system, it was also self-perpetuating, and she pointed out that's a normal way of doing things, and it normally works pretty well. They had generally good trust and confidence with the public, she felt. They had annual meetings, but they were not necessarily very well attended because there wasn't that much interest, because things were coming along fairly nicely. Once they narrowed it down to Mayo, they then entered into a formal agreement with them, much as exists now between the Medical Center and Essentia. Well, something like that. It wasn't an association at that point. It was an agreement to look in detail and negotiate possible integration or merger. And at that point, the board worked entirely behind closed doors until they had more or less all the details worked out. And then they held 2 public meetings. She was expecting, 100 or so people at each. She said they had 31 and less the next one, which I infer that was relatively not a hot topic in the community, but there was certainly some interest. There was much more interest in the decision for the cleanup piece to separate itself from the Sisters of Mercy organization that they had been part of it from the very beginning. And it was actually the sisters that had initiated that discussion. They felt that was necessary to move forward with Mayo Clinic. But I want to segue from that into the topic of the petition that some of you may have seen that I sent out in the wee hours last night. I have, in the efforts to get more public involvement, I've been pushing for the board to have meetings with the public, and I thought perhaps a petition would be a good way to express that. So I wrote that up, I sent it out by email, and I brought some of them with me. But I had my own reservations about that approach, and Mary Clint had more clear reservations, which she discussed with me. She said in her experience, petitions aren't generally terribly productive, and they can at times be counterproductive, and indeed they do kind of set an atmosphere of potentially an adversarial relationship, which is not what we want. What we want is a constructive, what we want to do is nurture a constructive relationship between the community, the board, the SACO, whatever the parties may be, where there is that trust and communication available. And I think it might be more productive to set that petition aside at this time and just continue. After all, the main point of the petition is that we want to have public meetings with the board, that we want the board to release more information to the public that isn't necessarily strictly tied to confidential negotiations, and to ideally involve a community consensus as much as possible in whatever decision is made. I think the board already knows that. Does anyone, is there a general agreement with you here on those points? Certainly there was at the last meeting.
Lady over there. I feel that, I just want my opinion to be heard.
Right.
And I want my way, actually, but.
Don't we all? Right.
But I have
Lady
a
over
definite
there.
idea of what we should take, but I'm not gonna, that's not important at this meeting, what my opinion is. But I feel frustrated. I mean, they should have an avenue for taking.
I'm sorry. See, I didn't get it yet. I'm just.
Public meetings are an avenue for the board to take a temperature of what the public wants with their healthcare system.
Mm-hmm.
And so I'm concerned that doesn't happen, and then they make a decision without doing that. So I'm glad with what you're doing, and you're pushing for the public input piece of it,
Yeah, and I'm hoping that these meetings will help make any ultimate future meetings by the board perhaps a little bit smoother, because some of the concerns will have already been aired and partially addressed, formally addressed. And there will be less of an outcry at the first finally public meeting for any kind of public expression. I think it would be hard to have a really constructive meeting if there hadn't been at least some dialogue prior to that. Do you have a question? No. Nonetheless, there's a... Go ahead.
Oh, I had a question that was about the talk that you had with... Okay.
I can't do anything right tonight.
With Bob Anderson, I understand that currently the hospital is operating at a loss. And prior to the, it's not a merger, but I don't know what you want to call it, affiliation
Affiliation,
for
yeah,
the center, we were we were doing very well. I don't know what the exact numbers are, but I know that we were doing very well.
In 2007, I think it was 18 million that they reported at the public board meeting.
So yeah, and I've heard that understanding expressed before. To a little degree, to a certain degree, it's apples and oranges. The context has changed considerably as far as what is viable as an independent organization these days. So the very same structure, now may not be able to be profitable. Also, I don't know whether the current profitability discussion, to what degree it separates between the clinic and the hospital being profitable. Rainy Lake Medical Center is now both. So if you want to compare the financials of the hospital then to the hospital, now you're talking about more or less half of Rainy Lake Medical Center. So it can be a little bit muddled, but certainly I'm hoping that we'll be able to put together some financial data, ideally that the board already has and can simply share with us, that will help to answer those big picture questions. Back to my conversation with Mary Clem, I agree with her on the petitions largely, but our situation here is different in some important ways with what they had in their board. As I said, their board was not in an affiliation prior to entering into a merger. We are in an in-between state, which makes the discussion of a possible merger more complicated. Particularly the board here is half appointed by Essentia and half appointed by itself, the hospital, the descendants of the hospital side of the board, if you will. And there is, whereas in New Prague there was not a particularly contentious situation, in here I feel like there's a lot of mistrust. Some directed more at one side of the board than the other, and the board has publicly acknowledged that their own relationship internally is fraught with tension. It would be a fair way to put it. And it's hard for the public to have confidence in the proceedings of the board as a whole when the board itself is divided, as near as we can tell. Also, our board has only been self-perpetuating for 5 years, so the memory of handing that power over is relatively new, and they haven't had much time or particularly conducive circumstance to build a relationship of trust with the public. And finally, the board, so far, to the extent that they've spoken at all, has chosen to speak through their CEO, Bob Haley, who was going to come tonight, but is not. And that raises a different set of concerns, all of which are the hand that Bob Haley has dealt, not anything that he's done per se. The first is a conflict of interest. As the CEO, he's contracted through quorum. And if the integration happens with Essentia, then presumably that contract would be eliminated. His employer would lose that income, and he could presumably find another job elsewhere. He's worked in a number of locations, but there's a conflict of interest there nonetheless. Also, there's been high turnover in the CEO position. We've had, 3 CEOs in 5 years, something like that. And at least the last 3 CEOs have all been from out of town, out of state, in fact. So they haven't had time to really get to know the community or even necessarily the institution, much less build a relationship of trust and understanding. And there's a certain conflict in representing the board, I feel, which has not been, there's not been explained how he can possibly work around that. He's been put in an impossible situation where his job is to represent the entire board and the institution, but the board is split into 2 halves, only one half of which is to decide about integration. So when he's asked to speak with the public about integration, he's essentially speaking for the half of the board that gets to decide that, but that half of the board is negotiating with the institution, essentially, that gets to pick the other half of the board, but Bob Haley represents the whole package, so I don't see how we can possibly really do that, and no matter who's in that job. It seems an impossible situation, and none of that was the case in New Prague. And finally, I mentioned this, since the last 3 CEOs at least have not been local, they don't even have ties to the community and pre-existing relationships that could potentially offset those other 3 concerns to some degree. And that is why I keep coming back to, there's a greater need for the board members to communicate directly with the public here than some of the other situations that we have had. But again, at this point, my inclination after talking with Mary and thinking about it myself is not to go the way of a petition, but just to continue to speak with them individually and hopefully as a group. And there has been some movements. Charlie Elloy has spoken also about the possibility of holding public meetings once more details are worked out. Not sure how much the details need to be worked out before he would favor a public meeting. Normally, indeed, it is done the way it was done in Prague, where they've got pretty much the whole thing fleshed out. They present it to the public for feedback, and then move ahead or not. But I think we need to be building the confidence and the relationship now before we get to that decision. That's all I have to say now before talking about the rest of what I call the meeting for, which was ideally to present information on what's the current situation of services provided, specialists available, that kind of information at the clinic and the hospital. Dr. Lawal has agreed to speak on those questions at the hospital. I have been unable to get anybody to speak for Essentia, and I am sympathetic to the reasons for that. Some of the people who could speak to it are on the board. Some of them are potentially below physician level, or not high enough in the administration to necessarily have the full picture. And the administrators, the higher up administrators, such as Nikovich and McGinty, who are based in Duluth, are willing to speak, but they're unavailable at this time. So perhaps in the future we'll be able to have another meeting where they are able to speak. Possibly Bob Haley would be willing to speak on some of the basic stats, some of which have already been presented at the Chamber of Commerce, the city, and the county boards. And I'm making as much of that information as I can available. Dr. Stone, who is on the board and is the medical chief of staff, is his title in the Essentia for the local clinic? Something to that effect. Section head, which basically means he's the leader of the local doctors. He said he was fine with providing that kind of information in written form, but from past experience in public discussion, it tends to quickly get into a gray area where it's hard for him to know where to draw the line between what's board information and what is appropriately public. So I think rather than reading the whole thing, I'll simply say that he provided a list. I'll hit it at high points of specialists, how specialists have changed since Swing Lake Medical Center was formed in 2009. Got that date right? I think so. Close enough. So we have lost rheumatology, outpatient oncology, 2 family physicians, an orthopedist, and an ophthalmologist. There are explanations as to each of those changes. And we've added sports medicine and a trainer, podiatrist, atrial fibrillation and congestive heart failure clinic, a new pulmonologist, a new family medicine nurse practitioner, a new mental health care provider, which is a critical area of
Actually,
care.
two new mental health providers.
2 new mental health providers, okay. He said also, in addition to that, a new psychiatrist and a child psychiatrist who will start in summer of 2013 and summer of 2014. And they'll be adding medical weight management and dermatology via telehealth at the local community. And we're continuing to have outreach from OBGYN, pulmonologists, sleep specialists, cardiology, pediatrics, orthopedics, physical medicine and rehab, EMG, a basic clinic, nutrition services via telehealth. And Dr. Nikovich provided a little more information on some of the background, particularly as to why some of those services that we have lost were lost. Generally, it's just a matter of staffing turnover, people retiring or moving on to a different job or that kind of issue, as opposed to a decision that essentially to withdraw those services for economic reasons. And all that information I'll put on the blog. Then I'll turn it over to Riki, more than plenty, and let her speak a little bit. And then we'll hear from Kimberly Perkins about some of the big picture issues of basing rural healthcare centers in general.
One question.
Sure.
Of those lists you just read off of the additions and subtractions, how many of those, which of those were hospital-based and which were clinic-based?
That's all clinic.
That was all clinic?
Yeah, his list was all clinic.
All clinic. What are the changes?
A little bit more.
Hospital, Ricky covered that first?
Yep, that's where she's going.
Perfect.
Thanks.
You got the camera.